Sure. In Indiana, if you're hurt at work, your employer has the right to what we call direct medical care. Now, the law actually says something a little bit different than the court system has interpreted that to mean, and the law says that the employer shall furnish a physician to provide medical care. The law doesn't actually say the employer gets to choose the doctor, but in reality, the judges have interpreted the law to say if you're hurt at work, your employer gets to tell you where to go for medical treatment, and so does the work comp insurance company. There's been a study released recently, and in some states, injured workers get to choose their own doctor even when they're hurt at work. And the study determined that for the most part, insurance companies are not paying more on work comp claims where the employee gets to choose their own doctors. Insurance companies in Indiana like to say if employees got to choose their own doctors, they would treat forever. And that study's saying that's not exactly true. There's little difference in states where employees choose their own doctors versus where the employer, like Indiana, gets to choose the doctors. It's good news in states like Indiana. We as attorneys for injured workers want to try to argue with the General Assembly, the lawmakers, that in Indiana, employees should get to choose what doctors they go to. Because insurance companies typically will say, well, that's not fair, our insurance costs will go up. But the study shows that that's not really the case, that insurance costs are pretty similar in two different types of states, employee choice and employer choice.